I think mental health has gotten better and worse because if you look statistically, mental health, more people are struggling with it and coming out, but at the same time, more people are coming out about it because society is starting to accept it more. And with accepting it, there's more opportunities for programs like these, therapy, or resources. So I would say that mental health is at a high right now, but there's also a lot more opportunities and available resources for people in college and the general public to use to get help.
And I think it kind of depends on whether or not it's getting better or worse. I mean, in certain areas you can say that it is getting better, and then other areas, yeah, it is getting worse. I think that as we learn how to deal with mental health a little bit more effectively, that we'll start to learn to solve problems, and we'll become more resilient. But then also at the same time, I think that with how often society changes and there's so many things going on, that's going to cause a lot more stress and obviously a lot more mental health problems. So yeah, things are getting better, generally speaking, I think, but just in the moment, it's obviously very difficult to figure out how we're going to address certain specific mental health concerns. I would hope to see mental health in the future obviously improve. Specifically, I'd like to see people who have access to more resources and tools so that way they can manage mental health on their own. So I would like to see people who can kind of just deal with their own problems on their own. I'm not trying to encourage people not to seek help if they need it, but obviously we do want to see more independence in that area.
Yeah, I think finding more resources of where we can find mental health access is very helpful, and the research we did is just a start to a lot more expansive research we can do onto finding ways to even help like rural areas and places that can't commute and find a therapist. These are online, and making resources cost effective could really help those who are struggling with mental health in low income areas and help mental health become aware.